Greetings. As you can see, I'm sitting outside in the beautiful sunshine on Saturday morning. At the allotment, actually. 3 days ago, this wasn't quite the case. I'm afraid I got a bit of an update for you. I've been in quite considerable pain for the past week or so. The pain's been going into my hip and round the side. I could hardly walk, and I reached the point on Wednesday where my husband was actually quite scared. He'd never seen me so down, and to use his word, so defeated. To cut a long story short, we got hold of my consultant secretary, and my consultant had gone. So I decided to contact the emergency chemotherapy nurses, who are absolutely fantastic on C3. I explained my situation, I explained the fact that I couldn't walk, that I was in excruciating pain, and they said, come in and we'll do some examinations. It was a mad panic thing, getting a bag ready, getting this ready, getting that ready, getting everything else ready. I went onto C3, and Andrew was right. I must confess, at that point, I was feeling completely defeated. The pain and the struggle and everything else was catching up, and my mind was going round with memories of some of the most wonderful people who I'd seen on the ward back in July, who I know are no longer with us. And at that point, I was thinking I wasn't going to come out of the hospital the same way I was going in. I was going to go in and not come out. Andrew said to me, where is all that hope? Where is all that positive energy? Where is all that enthusiasm? Where's that passion? And I looked at him and said, I can't feel that when I feel it's the end. I came in, and one of the most wonderful doctors, Indian doctor, who I believe has a kind of a pastor name. I can't remember what his name is. I wish it was a pastor name. I don't kind of an Italian pastor name, but an Indian. You know what I mean. Raghu. If that's in, oh, never mind. Dr. Raghu came and saw me and explained the painkiller situation and the possibilities of what this pain could mean. And of course, he used the T word. He said this could be, and he hesitated, and I actually said to him this could be another tumour, and he said yes. At which point I kind of disappeared into tears. But what he did was he knelt down, he came onto my level. He didn't stand up and look down at me, sitting in the chair. He knelt down up to my level, so I was eye-to-eye contact with him. And he asked somebody to get some tissues, and I had some tissues with me, so I was able to cry. He didn't hold my hand because he didn't know me. As Dr. Peter Simmons knows me, he feels able to be able to touch my wrist when talking to me, but he put his hand close enough that his hand was kind of touching mine. So he knew the understanding of touch as well. He knew the tone of voice to use. He gave moments of silence. He then went back through he had pulled the curtain round at this point, no understanding my privacy needs. And he spoke to me in a tone which was both respectful, dignified, and human. This is for you junior doctors, because on the next podcast I'm going to record in a moment or two, things change very quickly. But as you can see, there is a very positive outcome. But one thing I would ask you to learn, ask you to understand, and ask you to take on is the need for that tone of voice and that need of the understanding of touch, of how much you know somebody and how long you've known somebody to understand how much you can go far with touch. till the next podcast, which should be in about 2 minutes. But these have to be very short to get a message across. So bye-bye for now.